Well, in January of this year, 2016, I was updating some life insurance. So I had a blood test done, and I was surprised when the insurance company called and said that the PSA had come back high, so that they wouldn't be able to underwrite the policy. So I had done a little research, contacted a urologist here in Manhattan where I work, and gone in for my first urology exam. And they had taken a blood test, confirmed that the PSA was high, and then they wanted to schedule a biopsy. And that was my first meeting with him, so I started to do some research, look at different doctors, and figuring it was a biopsy, and given the results of the blood test, figuring it may be cancer, I contacted another institution, Sloan Kettering, and scheduled an appointment with their urology group. So I had gone to Sloan, and they had done the blood work, scheduled a biopsy. They also had done an MRI or a CAT scan. So I went through all of that, and I did the biopsy at Sloan. They confirmed that it was cancer, but the doctor I met with, he wanted me to do HIFU, which is high intensity frequency radiation. And you know, he was very quick with his recommendation. He didn't go into detail about what they found in the biopsy. He basically said it was one quadrant and it was highly curable. So he was very, very passive about it, but he was really pushing the HIFU. My wife and I left the meeting, and of course she's a professor and she was doing all this research on her phone after we left, and we realized, you know, HIFU was experimental here in the USA. It hadn't yet been approved, if I recall correctly. So she wasn't pleased with the results. She was insisting I get more opinions. So I had contacted the Cleveland Clinic out of Toronto to ask them about HIFU. I have a relative who had radiation done. And then we found, you know, through our research, Dr. Samadi. Now, originally I was against getting the prostate removed because I'd heard about the side effects, sexual side effects, incontinence. But after researching Dr. Samadi and, you know, all of the reviews on, you know, people who've had him perform the surgery, you know, all of the information that he put out there, we decided to, you know, meet with Dr. Samadi, and we called and scheduled an appointment with him. I work around this area, and you know, in the business I deal with, I'm used to dealing with some high-end clients and such, and so, you know, of course, when I walked into the office, you knew right away that Dr. Samadi is, you know, he's first class all the way. The office is beautiful. The staff is very friendly, efficient, all very professional. And so my first reaction was, yeah, it's a you know, top-rate organization. So I was really impressed with the professionalism, and just, you can tell this is a serious business here. Oh my God, yes. Okay. In the first place, you know, as I was telling other people, you know, in my research, and we did a lot of research, and you know, I was, as I mentioned, I contacted the Cleveland Clinic. I was on the phone with them. Sloan, and I have nothing bad to say about Sloan. It was just a different approach. But you know, and online you find a lot of these blogs, but what you're going to realize is that there are a lot of opinions and recommendations, and doctors say this and others say to wait. And I hear this commercial for this Cyberknife on the radio constantly, and of course that kind of puts me off. If they're advertising, I'm wondering, you know, why are they selling me so hard? I hear it on drive time radio all the time, and they talk about it like it's a surgical procedure. And when I actually researched it, it's nothing more, at least in my opinion, than a fancy radiation. So, you know, with all of this information coming at you, when we met with Dr. Samadi, you know, he's very in control, not domineering or anything like that, but he looks at your report, he tells you what he thinks, and he gives you his opinion, as opposed to others who, at least in my experience, have said, well, we think you could do this, you could do that, and they're almost leaving it up to you with all these options. But Dr. Samadi was very clear. He looked at the report, and I'll never forget this. His first words, he looked at the biopsy report from Sloan, and he said to me, there's too much cancer here. You need to take this out. And I'm a young, healthy guy. And as soon as I heard that, I knew right then and there I was going to have Dr. Samadi do this. And I was opposed to having the prostate taken out. But all the information, his results, I mean, it's just terrific. I can't speak highly enough of him. We went to Lenox Hill, the floor that his patients stay on. I joked with Laura that it reminded me of the Fairmont in Quebec, but it was a great experience. His care, just terrific. Everybody on the staff, terrific. And it's about 4 weeks later, and maybe I'm a unique case or not, but I have very little incontinence, and there is no sexual dysfunction. And I am a healthy guy, and the pathology report was good, so I consider myself very lucky. But I consider myself lucky that we came to see Dr. Samadi. So any man out there in my position, please talk to many doctors. Make sure one of them is Dr. Samadi. I've told Dr. Samadi, my wife, she's constantly on all these blogs. We were driving the other day, her phone beeps. She looks at it, and I said, "Who's that?" And she said, "It's a message from somebody on one of the blogs she's on asking," she's written about my case, and she's always recommending them. Obviously, they have to make their own decision, and each case is different. But again, yeah, go see Dr. Samadi. Again, I'm really happy we did this. I read about radiation, I read about other things, and I just know this was the right decision for me, and the results speak for themselves. But he's a really talented surgeon, and again, just really fortunate, to have had him, handle my case. I know it's nerve-wracking. I'm not usually somebody that gets rattled too easily, and I probably wasn't with the diagnosis. I take things rather, in stride. But again, I was a little annoyed at all of the information, and that there's no clear, protocol for somebody with prostate cancer. But do your research. Know about it. I mean, get educated about it. But again, urge you to see Dr. Samadi, because he's very thorough. He explains everything, and he answers all questions, and he's there for you. So really, it's 6 months. I wouldn't wish this on anyone to go through, but test yourself early, and just get it taken care of. Results hopefully will be good.